What is Dental Year? Dental Year is the leading marketing app in dentistry. Created by marketers, this resourceful platform helps your dental practice in a variety of ways. Content inspiration, real-time marketing ideas, tips on ROI with your current methods, fresh resources, and lots more.
We are welcoming in Nicole Greenman and Dr. Stephen Greenman from DSM Solutions.
Well, while Dr. Greenman's pulling up the slides, I'll go ahead and get started. Dental sleep medicine is something that you can have in your practice to help you stand out from the crowd, just like we have up on the screen. Some things that you can utilize maybe for your Waymark video, for your Google ads, for your search engine optimization, that is going to set you apart from the other dental practices in your community. And that's what we're here to talk to you a little bit about today. Snoring is the #1 sign of obstructive sleep apnea. And snoring's hilarious. There's cartoons about it. There's comics about it. It always makes you laugh when you hear someone maybe fall asleep on an airplane or in public and start to snore. But the problem is that it is a symptom of a deadly condition. Most notably in the news recently was the 2016 Hoboken train crash. If you remember, a commuter train crashed into the station in Hoboken, New Jersey. The conductor had undiagnosed severe obstructive sleep apnea, and so many people were injured in that accident, something that was completely preventable. And that really did set off, good news, a chain of events in the state of New York and New Jersey for testing MTA employees, making sure that everyone that had obstructive sleep apnea had been identified and is receiving treatment. Among some other notable moments of obstructive sleep apnea in the news, it is related to so many parts of our health. And these are all instances of maybe your patients becoming more knowledgeable about this condition. It is linked to not only dementia, but to bring it on home to what we're living through right now, COVID-19. Patients with OSA are at an 8-time higher risk for contracting COVID-19 and are 2-time higher risk for going into respiratory failure. A lot of studies coming up about that. Recently, a lot of articles coming out between the links between obstructive sleep apnea and COVID-19. It's attributed to a large semi-truck fatal crash in 2018. In that instance, the driver did have obstructive sleep apnea, but was not wearing his CPAP. A very, very common problem for a lot of patients, failing CPAP and not having a backup treatment. And as dental providers, and something we are going to talk to you about, sneak preview, you're able to provide an alternative and potentially prevent that. So do you want your practice to be the purple cow, to stand out from the crowd, put your head above the rest, say, hey, I'm here, I'm providing something that is talked about? Ariana Huffington made the LA Times bestseller list for her book, The Sleep Revolution. Sleep is imperative for our health, mentally, physically, for our productivity. And this is something that was read, that was really popular, that was talked about for a long time in the news when it came out. Also has links to Alzheimer's disease. Oxygen deprivation associated with obstructive sleep apnea can lead to a loss of gray matter in the brain. long-term leading to the development of Alzheimer's and dementia. So like I said, snoring is funny. This is an insert from Parade, which is a magazine that goes out in a lot of newspapers, specifically LA Times. Dr. Greenman and I are located in the greater Los Angeles area. But Homer got a CPAP. If you saw that episode, very funny, a lot of hijinks ensued. But the bottom line is that Homer is a key candidate. He sits at a desk all day, eating donuts, gaining weight. Also, something you can add to your practice. We're talking a lot right now about the state of our economy. A lot of people are saving their dollars, not spending on things, maybe like some of the cosmetic procedures, elective procedures that you're offering in your practice. Ultimately, dental sleep medicine is medicine. This is a chart from Dr. Greenman's office. During the last recession, you can see where we are, 2008, 2009, pre-OSA. Patients stopped using their home equity checks, using their homes like piggy banks, paying for those big-time cosmetic cases. And it hit the practice. We felt it. But with the addition of our new menu item, obstructive sleep apnea, you can see a very significant rise in our production and gross collections. And that's because medical insurance pays, and this is a medical procedure. Patients need it for their health, for their safety, and for their wellness.
I just want to go over a bit about how our production in our practice is augmented by treating obstructive sleep apnea. Our goal is to have one new patient each and every day. We do a 10-day working month. And so you can see that if you can add at least a few patients every month, you'll see how productive you can be. I don't have my latest numbers. It's been an odd year, I think, for everybody because of the COVID in 2020, but 2019 was a fairly typical year. Our fourth quarter income, just from obstructive sleep apnea treatment alone, was $70,000, and for the entire year was $225,000. Now, I'm going to come back to that in a few minutes and talk about how you can do this and add it to your practice without having to add to your overhead. And your most expensive portion of your overhead is staff salaries. So if you can add a service that will bring in significant income without having to add a staff member, I think you can you see the benefits. So Nicole was talking about recession-proofing the practice, and this is an area that you can add. It's a fairly easy concept to master, and if you put your mind to it and get to work on it, you can add a great service and quite likely recession-proof your practice like I did. It's profitable. The average commercial case, that would be PPO insurance, is about $3,500. Medicare, close to $2,000, and it'll vary depending on where you are in the country, what Medicare will allow, with laboratory costs in the range of $375 to $600. I'm not including some of the lower price ranged appliances because, quite frankly, you get what you pay for, and I'd rather have a quality appliance and not have to see a patient multiple times because of problems with their appliance. The other thing I want you to remember is that I don't spend any more time with my obstructive sleep apnea patients than I do with my recall patients, and generally it's less time. It's a matter of walking in for a follow-up, getting a report from my Lisa, who will tell me, George said that, his wife is telling him he's still snoring. It's a lot better, but I think we should advance the appliance. And I'll say, that's a great idea, Lisa. Why don't you advance it a millimeter? And George will see you in about 6 weeks. And it's literally that fast for the overwhelming majority of follow-ups that we have with our patients. As far as a new patient, maybe 10 minutes of my time is required. I'm a restorative dentist, just like probably many of you that are on the call. I also do implant surgeries. I do Invisalign treatments as well. Just showing you a few of the cases that we've done. That was an Invisalign. Here's a smile makeover reconstructive case that was completed not too long ago. And you can see, again, the before and after. So I'm a restorative dentist like you. I have spent countless hours in high-end continuing education residencies to hone my skills. And we do a lot with photography. And I really pride myself on quality and the quality of service that I can provide to our patients. Here's a kind of a straightforward sort of implant case for a younger patient. You can see that with the implant in place. I've added a lot of services to my practice since 2003. Why did I do that? Well, I wanted to have a diversified practice. Also, I'm interested in doing more procedures. It gets a little boring if you're doing the same thing over and over again. Hopefully there's no endodontists on the call, but if I had to do that same thing every single day, I don't think I could last in the profession. So I have a completed comprehensive aesthetic residency, advanced fixed prosthodontic residencies, advanced occlusion residencies, early third molar removal. I've surgical dental implantology residencies as well through the local dental schools, both USC and UCLA. I am permitted to provide intravenous sedation services in California. But I got to tell you that sleep apnea has probably had the greatest impact on my practice over and above anything else. So let's talk about why you should care about adding this service to your practice. Why do you want to do it? Well, the main reason I believe is that as dentists, we're obligated to diagnose this, or at least to get our patients toward getting this diagnosed. We are the only profession that sees the clinical signs of obstructive sleep apnea each and every day in each and every patient, okay? There's consequences to obstructive sleep apnea. Nicole went over some of these horrific accidents, the Hoboken train, crashes on the road that lead to fatalities. I mean, just horrible stuff. So increased motor vehicle accidents and on-the-job work-related accidents are a big issue with untreated obstructive sleep apnea. Also, poor job performance, cognitive dysfunction, poor performance in school. It can lead to marital and family discord. People with sleep apnea feel so tired during the day that they miss out on family events. People with sleep apnea can become depressed. They can be anxious. They can be irritable. So these are some of the social consequences. The medical consequences are huge. Hypertension, heart attack, stroke, congestive heart failure. Cardiac dysrhythmias are very common in people who have obstructive sleep apnea. As a matter of fact, that's probably one of the main reasons that we hear about younger men, particularly in their 40s, 50s, and 60s, dying in their sleep. They go down to take a nap, they don't wake up, or they're found dead in their bed in the morning because of these unchecked cardiac dysrhythmias that then lead to atrial and ventricular fibrillation. Person loses consciousness and they can go into cardiac arrest. GERD, gastroesophageal reflux disorder, particularly at night. Erectile dysfunction for men is a very common symptom of obstructive sleep apnea. And then some other condition called pulmonary hypertension, which is an end stage it's an end stage of life. It's typically a person who's really circling the drain that has advanced congestive heart failure. And then we talk about metabolic syndrome, diabetes, and we'll show you a picture of what that person would look like in just a minute. So deadly stuff happens at night when you're in your bed, there's no one around to help, And whenever you hear about an individual dying in his or her sleep, it's typically due to obstructive sleep apnea. So who are some of these people? Well, Carrie Fisher, not that long ago, she went into cardiac arrest after falling asleep, having a nap on an airplane because she had untreated obstructive sleep apnea. Some of you that are a little older may remember the famous Green Bay Packer, Reggie White, who became a preacher. Well, he died in his sleep. The CPAP was in the closet. More recently, Anton Scalia, the Supreme Court Justice, he died at a hunting lodge, a private hunting lodge, found dead in his bed. He left a CPAP at home. And there are others. There was just recently a Los Angeles City Councilman who took a nap on the couch and never woke up. So this is an important thing. And as dentists, we are obligated to recognize these symptoms and make sure that our patients are directed appropriately to get diagnosis and treatment. Here's a very frightening statistic, and I want you to take a look at this very carefully. This is the Wisconsin cohort study, an ongoing study. These are reports, a report that came out at the 18-year mark. And you can see here on the left, the y-axis, percent of survival, percent of people surviving. And then here's years of follow-up on the x-axis. Over here, these lines, the green line is normal, so no measurable obstructive sleep apnea. That's an apnea-hypopnea index under 5. This would be the moderate group. This group would this is the mild group, 5 to 15. The moderate group would have an index between 15 and 30, and the severe group down here has an index of greater than 30. And I'm going to see if I can get a little bit of a pen going right here, and I'm going to draw a line across here as straight as I can make it with a mouse. But I think you can see that approximately 40% of severe apneics are no longer alive after 18 years. And if that is not a wake-up call, I don't know what is. So is this guy in your practice? Okay. This is a person that would have what we call metabolic syndrome. He has hypertension. He has adult onset diabetes. You can see he's got this big central obesity, that's called, with that big gut that's hanging over his pants. So he's probably wearing a size 32 or 34 pant. But if he put the pants up around his belly, he'd be about a 46 or a 48. And I think we've all seen this person. He also has a neck circumference that's approximately 19 inches. So this guy has obstructive sleep apnea. There's just no doubt. And as dentists, we need to recognize that. Unfortunately, physicians will see this, talk about weight loss, but never test him for sleep apnea. And you can play a big role in this. Your examination is the key. Like I said, we're uniquely positioned to recognize obstructive sleep apnea in our patients. And I think we've all examined patients that look like this, whether they have enlarged tonsils that are almost touching, or they open their mouth and all you see is tongue, or they have an enlarged and maybe even an inflamed back of the throat and uvula, large mandibular tori. And also you can see the deviated septum where there's this asymmetry and the nostrils are not normal shape. I had a conversation with a renowned cardiologist in our area who happens to be a friend when I was first getting started in this. And I went up to his office to meet with him to let him know that I was offering this service. And I said, Irv, this is very easy for you to recognize when you look in your patient's mouth. And he stopped me right there. He said, I'm a cardiologist. I don't touch patients unless I'm doing some sort of intervention procedure. And, I also go to my physician for my physical. And I can remember as a kid, the doctor would be feeling me all over the place, looking in my throat, feeling my neck, checking me from stem to stern. Now the doctor sits in a chair across the room with the electronic medical record and asks some questions, maybe listens to my heart and my breathing. And that's about the extent of it. So physicians aren't looking for this. They're not really trained to know about this. As a matter of fact, those of you who are listening to this, if you just remember what I'm telling you, and I'm trying to make this educational. Obviously, we're here also to promote DSM Solutions, but I think a little bit of continuing education is nice to get. We need to step up as a profession and start to recognize this, start to get involved with patients getting diagnosed and treating this deadly condition. I talked to a lot of dentists who say, oh yeah, I've made some snore guards, and I put that in quotes because I want to caution you a little word about snore guards. And then you may have made these appliances, the EMA appliance or some variation of it, and there can be a variety of these types of appliances. But the bottom line is that these appliances are mandibular advancement devices, and they are considered durable medical equipment when provided by a dentist. And as durable medical equipment provider, you should only provide these types of devices after a diagnosis, okay? You think about it. You have a patient who's got very severe unchecked obstructive sleep apnea and maybe some other conditions that are putting them at risk when they're going to sleep. You make them this appliance. They have an adverse episode during the night with your appliance in the mouth. Do you really want to go there? Do you want to have to defend yourself in court, let alone feel like maybe you were responsible for a person dying? I mean, I certainly wouldn't want to have that. So there are these medical legal consequences, but I'm more concerned about the moral consequences, to tell you the truth. I think if your head is there, you're not going to get into trouble legally very easily. So how do we diagnose this? Okay, as dentists, we cannot treat this. We're not supposed to treat this without a diagnosis. Well, the gold standard diagnosis is in a sleep laboratory. There will be anywhere from 18 to 21 channels attached to our patient. You can see some of them here that are measuring brain waves, measuring eye movement, measuring airflow, measuring muscle activity for the masseter muscle. You can see the pulse oximeter around the finger. You can see this called a respiratory effort belt. There are EKG leads that are on the chest as well, and there's an electrode down on the lower limb that's looking for periodic limb movement. So there's a lot of leads on there. You're in a strange location, a sleep lab. You're being videotaped, and your sound is being recorded because you're being monitored by a technician. So it's a very robust diagnostic procedure of a very uncomfortable, terrible night's sleep. The other option is to get tested at home. So yes, we cannot measure as many channels. The minimum number of channels on a home sleep test would be 4. Some of the more advanced devices, like you see here, can measure up to 9. And this then will give us not as much information, but a much better night's sleep. Sleep apnea is probably, next to insomnia, is the most common sleep disorder. So again, we're not looking for some of these other odd or somewhat obscure sleep disorders, because the patients would tell you about that, and you would know about that in advance. And of course, you would want to make sure that they were evaluated by the sleep physician. So next, we want to get into treatment. What are the effective treatments? And again, snoring, it's in the cartoons, it's everywhere. But I got to tell you that it is loud chronic snoring is a potentially deadly occurrence. It's linked to transient ischemia attacks, for example, so mini strokes. The gold standard treatment is what you see here, which is the CPAP. Why is it the gold standard? Well, if a person will use it, it will always work. It will always reduce the apnea index into normal ranges. The problem is that less than half of the people who get them are still using them after a year. And that's why I say dentistry has the best product. And I'm not going to get into all of the evidence about why an oral appliance is not inferior to a CPAP in many, many parameters that we measure. But suffice it to say that I'm a firm believer that ours is the best product. And to make one of these, it's real easy. Okay, you already know how to do this. Okay, this is right up your alley. So the learning curve to make the records is a cinch. You can delegate it. I delegate all of it except for an examination and this bite registration that you see down here using a device called a George gate. Everything else is delegated in my practice. And now with the advent and the mainstream of digital impression making, you can do these models digitally. You can do the bite registration digitally. You'll have a superbly fitting appliance every single time, and you have unlimited storage of your models. This way, you don't have to worry about, okay, well, how am I going to keep my record of that? Because if you're digital, then you've got it electronically. And a lot of what Brad's been talking about, is digital marketing. And digital dentistry is certainly something that will set you apart just by having this sort of thing. When I tell my patient, look, we're going to make impressions, but we're not going to have to put that gooey stuff in your mouth. They they're so impressed and so happy that we're not doing it that many of them ask, are you a regular dentist too? And so, we make a point of letting them know that we're a full service dental practice, and you'd be amazed how many patients come to us particularly for sleep apnea treatment, that become dental patients. Tremendous number of them.
So, now that we've learned all kinds of amazing information about what we can be providing to our patients, how do we let them know? How do we help market to our existing patient base? We know around 25% of the patients that already come to you, love you, trust you as their dental provider, have obstructive sleep apnea. Many of them have already failed CPAP or refused to get one in the first place. And identifying these patients is quite simple. I'm going to give you a key piece of information, something that if you're taking notes, write down, take home, start asking your patients today. Have you or anyone you know ever been prescribed a CPAP, and are you currently using it? Door open, ready to go. Talk about dental sleep medicine in your practice. So about 25% of your patients have OSA, and a typical practice will see about 8 recall patients a day. That's with one hygienist. You can increase that number accordingly. That's about 2 patients a day, 8 patients per week, 32 patients per month coming into your practice, sitting in your chair with obstructive sleep apnea, rocks ready to be turned over.
Nicole, I'm just going to interject. All of us who are dental practitioners have experienced patients where once they're comfortable and the local anesthetic is profound and you're doing treatment, they fall asleep. Those patients have sleep apnea. They're falling asleep at an inappropriate time. So not only are they in the hygiene chair, but doctors, they're in your chair as well.
I once got a call from one of our clients years ago, and I could hear the guy snoring in the background, and the doctor was asking me, well, do you think we should screen him for sleep apnea when, he's not loopy anymore? And I was like, yes, I can hear him snoring. He's sedated in the chair, snoring, sitting up.
Hilarious.
So let's say of those 32 patients, a quarter of them agree to treatment. Remember, the reimbursement rate is around $3,500. That is an additional $28,000 per month. That is an incredible increase in your practice's bottom line by simply asking your patients basic questions.
And remember, this is all done without having to add to your biggest overhead portion, which is staff. You can,
Exactly.
yes, you can train your pretty much your least qualified assistant or front office person to do the initial consultation and to even do digital impressioning. It's very easy to do. A layperson can learn it in an instant now. These devices are so user-friendly and so quick to get impressions, because we can do large digital impressions faster than we can do normal polyvinyl impressions.
Right, without numbers. So our motto here at DSM Solutions is add water and stir. We're able to help your practice gain the knowledge, gain the tools that you need in order to hit the ground running with treating not only your existing patient base for obstructive sleep apnea, but becoming a pillar of the community, a place to go for patients that are suffering from untreated obstructive sleep apnea or who have failed the more traditional treatment modalities. So like I said, we offer training. We've always been web-based. It's live webinars. That means no travel. It is full service. Our goal is for you to be able to speak to a group, just like Dr. Greenman spoke with us today about this condition, and able to talk to your patients as well. We offer mentorship. Dr. Greenman is a diplomat of the American Board of Dental Sleep Medicine. We advocate for the highest standard of care. We're going to hold your hand through the process so that you can achieve your goals with dental sleep medicine, whatever that may be. And we're available to help you 24/7 with all aspects of building a successful dental sleep medicine practice. And we're so humbled to be on the phone today with some real marketing giants. We'll offer a couple words of wisdom. We'll get you set up with systems. Our systems are pretty basic, a really comprehensive binder with the treatment forms, letters, in order for you to communicate with your patient's primary care physicians, with sleep physicians in your community, and build a successful dental sleep medicine practice. We can help you get set up with sleep studies for your undiagnosed patients, be it a third-party testing solution, interfacing with sleep physicians in your community, and even at-home sleep studies that you can have in your practice and provide to your patients. As well as getting you set up with a medical biller. I think that is I know that is a huge roadblock for a lot of practices that are interested in getting started. Well, don't I have to bill medical? Yeah, but guess what? You don't have to bill medical. We will set you up with a highly qualified medical biller specializing in durable medical equipment, specializing in sleep apnea, to handle that facet. You're a busy practice. You want to be turning out these cases. Let the professionals do what they do. Medical insurance pays. Like we've been saying, average reimbursement. I know the print on this is small, but Anthem, Blue Cross, popular insurance for our patients to have, paid us $4,259.63 for an appliance. And guess what? The office only had to ask a couple of questions. Now, this is a real Cadillac one Dr. Greenman circled. This is Blue Cross Blue Shield, $6,266.34. Asking your patient, how would you rate your quality of sleep? Have you ever been prescribed a CPAP, yes or no? Are you using it? So like I said, we are really on the phone with some giants today that really know how to put a practice's services out there. But something I want to note, we will help you get inspired for your marketing so that the pros can do what they do. I believe it was Kay Ann mentioned, don't write off print marketing. We like to run ads in local newspapers because who has obstructive sleep apnea? More of the middle-aged community, and who's reading a local newspaper. So we want to really target our audience, and a really simple message: frustrated with your CPAP, hate your CPAP, there's an alternative. Call us today. It works. Our phones ring. People get really excited. They want to know more. Back when in-person events were a thing, we had huge turnout at our informative seminars and at the health fairs that we did with a clear hate your CPAP, we can help messaging. Put sleep apnea on your website. I mentioned earlier SEO, and someone's on their computer looking up alternatives to CPAP or Googling I hate my CPAP. We want your name to come up first, so make sure that you are set up for success in that regard. And my contact information, I will also type in our website into the chat bar. Please check it out. It's a great resource for information about sleep apnea, implementing sleep apnea into your practice, and of course has all the information about myself and Dr. Greenman so that you can set up a complimentary consultation with us. We'd love to talk to you about your practice. We help practices nationwide, from Alaska down to Hawaii, down to the Keys of Florida. We are really passionate about helping private practice specifically, and helping private practices thrive, and adding menu items like obstructive sleep apnea that you get to do with your mind is a huge part of it, and especially one that's kind of fun to do. You really get to sit down with your patient, ask them questions, increase their quality of life. And instead of them standing up and saying, I hate you, that was the worst thing I ever had to go through, they stand up and say, I love you. I'm sleeping in the same bedroom as my significant other again. I get to come home at the end of the day and play with my kids instead of having to lay down and take a nap. I got a promotion at work because I'm not napping under my desk at 2 like George Costanza from Seinfeld anymore. And it feels good. It's incredibly morally rewarding, not to mention the financial benefits of billing medical insurance and providing another menu item that can be run by members of your team without you having to take your hands out of that patient's mouth. Doctor, you get to continue doing those high dollar value procedures that you need your license to do, while your team can be behind the scenes on roller skates, taking impressions, getting cases going.
It's just a game changer that simply by asking those 1 or 2 questions for existing patients without having to hire new team members, delegating all the tasks, clearly, most importantly, saving people's lives because it's so important. But besides that, and on a whole different category, increasing revenue so much dramatically on this dental sleep apnea, it's a no-brainer to implement. What I thought was very powerful is those terrible news stories and examples and images you were sharing, but they are impactful. Do you ever do something, Nicole, probably this would probably be you rather than Dr. Greenman, when you're on these consulting calls with your clients, do you ever do something where like you record them or have them do a video, or they like talk? I think if one of those things you offered, or you just told them how to do it on their own, where they would actually record a video talking about sleep apnea and then like having that on their website page regarding sleep apnea, because it's a very informative type of service, and I feel like that video will be helpful. Are you able to help at all?
Absolutely. We encourage all of our clients to pull out the iPhone if a patient comes back for their follow-up and starts singing your praises. Pull out the iPhone and ask them to just say a few words, 30 seconds, about how wearing a mandibular advancement splint has improved their life and in what ways. And you're going to learn some funny things. You're going to learn some really heartfelt things, and put that up. It's really simple. It can go on the socials. It can go on the website. It can go in a blog, anywhere you want to put it. And we have these great little pocket cameras ready to go at any time.
I'll add that these devices are so effective, and they make such a difference for people that 80% of the people who get them, or a little over 80%, are still using them after a year, and they continue to use them. So on your follow-ups, it really is a no-brainer. How you doing with it? And then, hey, would you mind sharing how it's working for you? What has it meant for you? How has it maybe changed your life, or your relationship with your spouse, or just how you feel? So there's lots of questions that we ask that could be geared toward what the person was complaining about in the first place. And again, like Nicole says, very easy to do, very easy to put up on the website.
And set you apart in your marketing. Some of these great companies that were featured today, maybe not just the same old implants and smile makeovers, something
it's totally different. And even how Amber was talking earlier about the postcards, I could see practices, maybe every month, or if they're doing this quarterly postcards, maybe 1 month it's sleep apnea messaging for that, and then the following month it could be implants, or it's not just the same messaging, so they could then test conversion based on messaging. And really, I think postcards and offline traditional marketing for sleep apnea, it's a no-brainer. Postcards, newspapers, print magazines, along with some targeted Facebook ads probably as well, right? But I would say more paid would go towards traditional print as opposed to like Instagram for the sleep apnea services. You could do both, but maybe more effective spend would be like traditional, yeah?
Yes.
Oh, sorry, go on, yeah?
No, I'm just going to say that it is a condition that skews older, and so it gets worse with age, okay? Gravity affects us all as we get older, and sleep apnea is no different. And, interestingly, that postmenopausal women develop this condition to a significant degree, which is something that you got to ask everybody. Don't think that this 60-year-old woman who looks like she might, that she's fit, doesn't have sleep apnea or isn't snoring. Ask.
So just ask everyone.
Ask everyone.
Even maybe adding a quiz to a website as well, like a dental sleep apnea quiz.
There you go.
And that's something that we can provide our clients with. We have a great dental sleep apnea quiz that can be embedded into a website, into an email. That's a great.
I think the whole focus right now on these virtual consults is cosmetics and smiles. There's got to be a dental sleep apnea consultation. Like, why don't we start either on our next webinar we do together, or stuff? The focus should be crafting, like implementing a dental sleep virtual consultation. Like, that should be way more important than like porcelain veneers, I think, right now, because let's make sure they're sleeping properly and don't have sleep apnea, or you fix it, and then let's talk about your beautiful, healthy smile, because I think the safety of the patients is so important.
That's interesting that you bring it up, because I'm connecting with a physician who has a sleep physician who has really developed a niche boutique practice, concierge type practice in sleep medicine with virtual consultations. And she's in another county. She's in Orange County. So I'm in Ventura County, and she's got clients up here. So I'm going to be developing that. And that is something, once I do get it developed, of course, we share everything with our existing clients. Okay, it's real important that our clients know that if I'm able to develop something that works, I'm going to share it with you and give you all the resources that I've developed. It's part of our package.
Well, we're talking next week for our own call. I'd like to talk about helping you implement that consultation for sleep apnea, and then also maybe coming up with a one-pager or some type of instructional video where your clients could go ahead and do that on their own, right? So that same methodology around the virtual consult for cosmetics can then be implemented for sleep apnea consultations, whatever they're using, right? Whether it's Doxy or whether it's a podium video chat, hopefully, they could then have a HIPAA-compliant solution to do a video consult, make sure you're able to fix the problem, and then book them for an in-office visit. That's great.
Wonderful. Well, thank you, Brad, for inviting us to be part of this great program, this Dental Marketing Ideas Conference, and we'll look forward to doing it again.
Absolutely. Thank you guys so much.
If you're looking for more reach, engagement, and conversion with your dental practice marketing, download the Dental Year app today.